Thank you very much for attending today. It's really amazing to see that how everyone has reacted to this invitation. I wasn't expecting that, especially after the new concept. That is probably, it's not that new having a doctor that visits everyone at home and conducting what has been even seen in all over the black and white movies over the years. The doctor walking in with the bag and all that. And that's my brilliant brother over there, and with the help of our amazing marketing team led by Yasmin, I don't know where she is, they came up with the idea of the reinventing home doctor. Basically, what we're going to talk about today is, I will start giving you the hint about how we started Medihealth Solutions, starting from Australia, where I live at the moment. The whole idea, as you understand, would be based on, that's not working, I can't really. The exposure and the history would change your attitude to a lot of things as a human. All your experiences at the end of the day just pulls down into your acts and who you are today. We all go through the stages of development, and we all reach a realization of a fact. And my journey as a surgeon, I started in Egypt as a cardiothoracic surgeon. I finished my qualification in 2007, got my specialist degree in general surgery and cardiothoracic surgery, had a passion for that, and I worked in Qatar for 2 years, and I fell in love with this country, and there's a reason why I'm coming back here. For that reason, I think it's an amazing place to be. I've always seen defects in all the health system all over the world. There's nothing is perfect, but what we aim to is maintaining a state of trying to achieve perfection, because that's what we all want to be, trying to achieve perfection, because if we reached it, there's nothing after that. So the process of keep on trying to enhance, and I always say there's always a room for enhancement. And I believe that Qatar is already amazing. Health system is one of the best health systems I've ever seen, but there's always small room for enhancement. Do you agree with me? Does anyone agree with me? There's always small room for enhancement. Can you nod your head? Hands up. Hands up. Any yeses over there? Yeah? Back there? Good. We all agree on that. It's not major though, it's called enhancement. We're not criticizing, we're trying to improve what is already good. Accentuation of beauty. I love beauty. That's why I'm doing plastic surgery at the moment. And there's a reason for that. So beauty is in everything. When we come, my brother and I, and we decided that, we've been around now for like 16 years, doing a lot of things, we realized the fact that we can't wait for change to happen. We've got to make that change happen. And we actually started planning for that. I said, listen, I'm quitting working with the government. I was working with the Queensland government for 5 years, and it's like, this is the time to start, making the change happen. Working under discipline is not a bad idea, but if you have power and energy, it's like burning out a V12 car into a 40 school zone. There's no point driving it there. It's the same. So if you got the energy, if you got the will, and go for it, and that's what we did. We started up a company which is called Medihealth Solutions, International initially, and that was in December 2014. This company was basically, the whole idea was to cover what was called a deputising medical service, and that's a service that's been created by the Australian government to cover the gap after what they call after hours. Because unlike us here in the Middle East or in our region, we're all like GPs 24/7. You get a phone call from your neighbor in the middle of the night, wake you up, and you got to go there and see them, even if you're a medical student. Do you know that? Any medical people or any doctors around, apart from Dr. John there? No? Yeah, so he probably is aware of that. So you get the phone calls, you run there, even if you're a medical student. So we're all GPs. We learned a lot during our journey from being, medical students to serve our community, and that's a passion. You develop that. You feel it's not just a passion. You actually get the merit and the vision and the mission of being a physician. It's something that you just can't say, no, that's not my deal. There's an accident down the road there. No, I've got nothing to do with that. You got to stop. You're always in action. You're always working. An airplane, Qatar Airways, for example. I resuscitated a pulmonary embolism 2009 on my way back from Cairo to Qatar. Yes. Yeah. They got my baggage through pretty quick. Thank you for that. Yeah. So this is the thing. You can't close your office and you go there and you're so like, I'm done. You're always a doctor. You're always serving. And being a plastic surgeon for passion, that's what I do for enjoyment. It's my hobby. But what we're doing is, serving the community. We achieved 8,000 calls in the last 2.5 years. We've driven 150 kilometers around Australia, 150 Ks around Australia over that time period. 2,500 hours of work to achieve that. That includes newborn, that includes geriatric, even at the aged care facilities, everything. And I said to Hisham, like, at this stage, Hisham, and I have to acknowledge the huge effort his Mrs. Shahdan there to keep up with his stress. He was like all over the place for the last 3 years trying to make this thing happen, trying to create a new culture in a new place. You know how that could be very challenging. But I know you guys, once you understand that culture, you can't get rid of it. It's going to be a part of your life. That's what you need. We are here not to displace. We're not here to create disruption. We're here to fill gaps. There's a lot of entities here that I can see today, the health insurance guys, the private sector, the public sector. Everyone is here, but we're all here for one reason, which is serving the public. We're here to actually give the patients or give our community the right medical care, what they deserve. No matter what your main domain is, it doesn't matter. We're all serving that. Some of us might be feeling, I don't want to pay that money. Insurance guys, where are they? Insurance guys? There they are. You don't like paying, but I promise you, you would love paying when it comes to us. Because we follow regulations, we follow what's been stated in medical books. There's no extra test done for no reason. Okay? Not because of the money. I care about my patient. I don't want to stab him a couple of times in his arm to get some blood that he doesn't need. We're humans, they're humans. We're serving humanity. There's a mission. The patient rights and the continuity of care is what created the deputized medical service in Qatar, in Australia, and soon Qatar. Deputized medical service, it explains itself, or medical deputizing service program. You close your clinic. Are you done with your patient? Doctor here, Dr. Omar there. No, you're not. You're always a doctor. You can't dump your responsibility unless if you officially hand over your patient to someone and say, look after my patient. It's my duty of care until I die. That's it. I touch you once, you're my patient. And that's where it came from. Clinics closed by 5 o'clock. Medicare, which is the Australian insurance companies, you guys probably know all their medical because they're one of the best, billing schemes because they're actually very tight on us over there. You understand that? So you probably want to follow the steps. My advice not to. I'm just kidding. And the thing is, Medicare has actually created a little bit of a lag in doctors' compliance to provide the service because it's not worth it. They're humans. It is human nature that you need rest when you overwork. You need some rest. You need to rest. It's like a pilot. You agree with me? You've got the fatigue policy, don't you? You can't fly a plane. How about human life? It's the same. Doesn't matter if it's an airplane, offshore. It doesn't matter. It's human life. If you're managing human life, you need to be responsible. Fatigue policy billing codes created a lot of problems. What happened in between 1990 to 2000 in Australia, there was a lot of reforms that actually boosted the performance to some extent. After that, the medical rebates from the Medicare guys, so it's all about the money there, unfortunately, for some reason, started to pick up. The industry started to pick up from being a deputized medical service, single provider, into corporate providers. Is that a bad thing? As you're at home, you're sick, is that a bad thing, having a doctor come and see you? Anyone is against this idea? Wintertime, you're feeling cold, you really got a bad flu and you can't leave, and you've got really a good meeting, your boss is gonna fire you tomorrow if you don't show up and you don't have any medical certificate, just say yes. It's flu, I know, it's not really, a heart attack. We're not really treating heart attacks. We're treating primary health care. It doesn't really matter. It can't change your life. Having a flu, your boss doesn't like you, your life is changed. It doesn't matter. Human wellness is important. It doesn't really matter what's happening. If you're not the person that you should be, attending all the important, whatever your work is or your school is, the problem is you need to prove that. For example, medical certificates or something like simple, but that's not what we're advocating here. What we're saying, wellness is important. It doesn't matter if it's category 4, medical people, means like it's not very urgent, or category 5, not even very urgent. It is something that is going to impact your life somehow. A lady that's got like a couple of children, her husband is offshore mining, she can't leave house and take, the 5-year-old because the other child is asleep, something like that. What are you going to do? Just let the other child? It's not fair. You're going to take them to the emergency department and wake the whole house? No. That stopped working. Can I get some? Yeah, there. No, it's working, yeah. So there was a study done. Sorry. No, it's working, yeah. Deloitte's announced a lot of people interested in business. They will know who Deloitte are and how credible that as a reference for analyzing the financial perspective of this industry. And it actually has conducted a study over a population. Dr. John is nodding. He's probably read that study for some reason. You know the study, Dr. John? So, yeah. So they compared two places in Australia, New South Wales, which is the Central Coast in New South Wales, and the Gold Coast in Queensland. They're very close in demography, population-wise and the service-wise. But the service was provided in New South Wales was just the emergency department, and the Gold Coast was the deputised medical service or the after-hours services or home visiting doctors. Significant difference between the money spent on patients going to the emergency department in comparison to ones that has been attended at home by the home doctor service. I know Dr. John is aware of that. There might be a little propaganda there because we all know that health system has been always influenced by a lot of variables. It doesn't necessarily mean that there's a conflict there. However, the numbers and the figures are the best judge to tell you. A simple cost to the emergency department in Australia, just walk in. You've got a flu, you ran out of the prescription for your hypertension tablet, you walk into it, it costs you $440. It costs the government $440. You don't have a transport, you live in a remote area, it costs you $1,300 to get into the emergency department just to get a hypertensive pill. Is it worth it? No, it's not. How much does it cost? $128 just to call someone to come. The problem was the conflict was simply state government budget and federal budget. and hospitals are covered by state budgets, and the Medicare is obviously a federal budget. That's not the deal. It's the problem we're talking about here is the service and how it served people. We did a survey that has proven that 40% of our people that has been by the deputizing medical service, as you can see, have actually voted that their alternative would have been going to the emergency department, which is costing the government at least, $440 instead of the $128 at the end of the day. Medihealth Solutions has seen it, the 8,000, 2,500 hours, and 150. And we have assisted during the last floods in Queensland. We worked during the floods. There's videos there on our website. You can see it on the Facebook page where all that flash flooding coming around, where we're working. We provide the service anytime. We're there to serve. Now, what we are talking about here today is not just the service. We're talking, I know it's a lot of information to digest, but we're talking about the technology. Technology now is really scary. A lot of us are scared of the, is anyone like following the news and talking about the artificial intelligence and the Saudi Arabian robots and all that sort of thing? Anyone is aware of that? Yeah, Sal is nodding. She said like she's gonna, destroy us all or something? Nah, there's nothing like that. It's all fiction. There's always a human being behind everything. Do you agree with me? You agree? We are behind that. No one can beat a human. We survived since Adam and Eve, and we will survive until the judgment day. That's it. It's written in Quran, Torah, and everywhere. We all know that. Nothing is going to end this up until God said so, right? That's it. So, Royal Australian College of General Practitioners have actually come to a realization that not just the Royal College, it's actually the health regulating agency has actually came up with the guidelines that actually regulated the e-health, telehealth, and M-health. Does anyone know what the M-health is? No? M-health is mobile health. That's what we're providing. Mobile health, healthcare comes to you. Mobile health. Telehealth, communication through telecommunication. E-health, medical recording. There's pros and cons, and everyone is aware of, everything can be hacked and everything can be, breakthrough and all this, the medical information, how that could be a really a big failure in any system if you lose such important information about your patient's privacy and all that. And we all know that. Thanks to the Bitcoin, anyone is investing in Bitcoin here right now? Good on you. So Bitcoin came up with this technology. The technology, what is it called, Hisham? Blockchain. What's it called, Dr. Blockchain. Mr. Macharbas, we had a good chat about that. Blockchain. Blockchain. Can you imagine the Australian government adopted the blockchain technology, encrypting patients' data? Don't run there and buy Bitcoins. No, that's not an advice to do that. No. This is not the idea. The idea, what I'm saying here, the technology behind that has protected us from your own fears. The boogeyman, we've always been that. Humans, when they saw the fire, the lion, they saw the fire, they ran away. It's instinct. You don't know something, you just freak out. I don't know it. I don't want to see that. I'll stay in my comfort zone. It's always greener on the other side. No, it's not. There's always pros and cons. But we work with evidence-based practice. This is our motto. If it's not scientific, if there's no evidence behind it, I don't see it. It's not there. There's doctors everywhere, and everyone is aware. I'm sick. Where should I go? Who's the best doctor? Does anyone hear that before? Did you get a phone call from your, mate, and he's like, oh, hey, man, you told me that there was a great doctor that you've seen the other day. What's his name? Where is he? Has anyone been through that before? Has anyone done that before? We all did that, right? Why? The lack of trust, right? When you go and buy a Lamborghini, anyone's got a Lamborghini here? How about you, Dr. No? No? No Lamborghinis? No, okay. Anyone's got Lamborghinis? No. whatever your car is, the trusted brand, you go for the brand, right? You know that it's not going to just, break down while you're driving on a highway or something for no reason. Why? Because there's quality, there's standards. Something regulates, something creates trust. And that's what is all about in the current medical practice. And that's what we are doing right now. The current medical practice, what makes us different is that we deploy standards. We put it in action. You call at-home doc, we've got great doctors. Where are they? There. Ahmed and Ahmed there. Great doctors, very qualified. Soon you'll hear about the testimonials. We just had like a couple of really amazing feedback on our Facebook. They said, like, listen, these guys need a little bit of acknowledgement and appreciation for their effort. And you soon will watch a little video there that would tell you their the experience with the doctors and all that. That's because of the standardization of care, and we making sure that everyone gets what they deserve to have. It's not about the doctor. It's about the trust. You trust the brand, and you trust at-home doc because that's what we provide you with, the trust. Trust your doctor. They go through a panel of 4. You remember the tour show you went to, through the interviews and how the qualifications are complying with Australian standards and American standards and whatever is equivalent. Not that because we're saying the other, nationalities. I was born in Nigeria. I'm from Egyptian background. I lived all over the world. I'm a global citizen. I'm not criticizing anyone. I respect everyone. That's not the idea. What I'm saying is, the standards. Why do we say Australian qualification, American qualification, or British or whatever? Because we're looking for standards. We want to make sure that this person's been through it. So you pass through that, you passed all the criteria, you got all the tick boxes. Anyone in the industry, you tick that box, yes, it's valid, 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 valid. Sell to consumer. No one's going to sue us. No one's going to die. Right? This is the same. Validation. If you're a valid person to handle human life, that's what we are after. We want you to feel safe calling the number, the hot number, going on the phone app, registering, going there. You know that the person that's going to come and see you is the best. He's going to do what you need to be done. The selection, the education, and the ongoing continuous medical education that we go through in the CME or CPD or whatever you want to call it, Australia and America, anywhere, continuous medical education. You can't just finish your medical degree and you say, like, I'm a doctor now. No. Science keeps on changing every day, right, Dr. Omar? You know that. You remember when we used to do the midline laparotomy, and now we're doing laparoscopy and all that. Things are in dynamic process of improvement, and there's always place for enhancement and improvement. So we want to make sure that our doctors are always keeping up with the pace and up to date with their information. And they go through the very tight CMA program. They go through pre-employment 6-module preparation that they actually made me suffer chasing them all the time. You've got 5 days running, 6 days running. The guys from Austin is a company that we have contracted with, specialized in medical education for doctors, not just for scientific aspect, for the humanitarian side, how empathy, dealing with difficult patients, dealing with stressful situations, and how to handle, a lot of sophisticated medical things. I won't go through it because not everyone here is interested to hear that. We do regular hand hygiene, and we acknowledge the importance of infection control, especially in this part of the world. Qatar is the best in the Middle East, in handling the infection control and abiding with the antimicrobial stewardship in comparison to different countries where you just walk in and buy whatever is there. And we follow only the guidelines for that. We don't want to build up, a big I would say, army of invincible bacteria like VREs or MRSAs or whatever. The prescription guidelines, the protocols of documentation, And that's what we follow. The national standards, the national safety, quality of health service standards, and that's an Australian program. This is the standard number 1, as you can see there. The guidelines for safety and quality in health service. Quality, the standard number 2, partnering with the consumer. Do you want me to stop that, because none of you is very interested to know exactly what that is, but I'll put it in a different way. This is the way that the literacy, the normal literacy, will make you able to understand what's written there. Implementing the process to empower the partnership with your customer, or between the doctors and your client, or your customer, the patients, let's say. Sometimes they're not patients, they're clients, sometimes they're patients. The consulting with them, with their concern, and providing them with enough information about the data that they trusted you on, or your medical finding, and if you share that for, let's say, research projects and all that. Patient infection control. So this is, we all know that. We don't want to go through the details of that. The information of how to prescribe medication with safety, because patient safety comes first for all of us. Then the identification, or making sure that this is the right patient receiving the right treatment. And we were talking about that. We all heard on the news that the doctor took the wrong kidney out and all that. It happened. It happened everywhere. Even in Australia, a couple of years ago. It happens. Like, failure of identifying the right patient, the right procedure. It is one of the qualities that we apply before we even, touch you, take some blood out of you, or give you an information or a feedback. We need to confirm that this is the right patient receiving the right care. The high-risk falls and the others are really not very common here in Australia, but it's very common where there's a major geriatric population in a nursing home and all that. But because of the culture here, our geriatric patients are actually still a family member that lives with us and all that. But we still cherish the assessment. We follow the protocols, and we make sure that the standards are being followed, and we make sure everyone goes through this tight process of control, making sure that the outcome is within the expected statistics. Why we're doing that? Because we're hoping in about 2 years, or hopefully 2 years, we get that official accreditation. Now we're about the patient safety. We just went through that, and back to the service and how it's very accessible. Does anyone here downloaded the app yet? Anyone's got the phone app on? Phone's up? Who's got the phone? Yeah? Only you. You wasted the chance of having, was it phone, iPhone? What was it, Hisham? Is it iPhone 10? No, is it X? Yeah, there you go. So the phone app is one of the portals. You got the website, you got the hotline. We are very advanced. We're thinking in advance, but we did not ignore the classic model. At the end of the day, we're serving the population. I don't really care if you got a phone. I don't really care if you got a smartphone. Some people don't even know how to use a smartphone. There's always a hotline. We did not ignore that. Everyone is counted for. Everyone matters. Everyone. We care about everyone. All the same. We belong to this community. We're here to serve this community. We're here because we know where this is going. I came here when I came, it's like they cut out 2030. I said, why not cut out 2018? I'm in. Cut out 2019. Cut out 2020. Cut out 2021. I'm in every year. Every year I'm here in Qatar. Why? Because they've got the mission. They've got the vision. We share all that. Look at Qatar Airways. Applause for those guys. Qatar Airways, Qatar Airways, the health sector. Applause for the health sector in Qatar. One of the best in the region, right? This is the country. This is the place to be, right? This is This is it. Anyone surfing here? Anyone from Australia or America, anywhere near the ocean where you go with surfing boards and jump over the waves? No one's doing that. Surfing is all about the wave, where the wave takes you. You know, we're right time, the right wave, and this is where the wave is. This is where we're going. This is where we're heading. This is where we're being attacked. This is why we should surf through this. Tamim al-Mag. We will surf through this, right? And we will get there soon. The last standard is closing the loop of care. What we care about. I don't care to go there and get the money and out of there give you the prescription and see you later. No. I see you once, I'm responsible. I have to follow you up. You can get a follow-up visit the next day, the day after. You can have a phone call if it's not really that urgent. Your blood test will be followed up. The results will be reviewed thoroughly, and you will get the feedback. If you need a referral, if we're in doubt, we explain everything in details. You need to know everything about you. How many of you go, how many of you would go to the doctor and they would walk out and they know, they told me I have this, you ask them a question, you can't tell you why, because you didn't understand that. You need to understand everything about you, right? You will understand everything about you. I really know sometimes it could be a little stressful, but we really care about you. We say it in a really nice way. It's like your mom when she, hugs you and tells you, so next time you do better in the exam, this is not the end of the world and all that. We'd go, I'll hold your hand through this and we'll make it through. That's what we do. We care about you until we put you in a safe place. Referral, admission, send you to hospital, or follow you up and make sure that you're safe. No matter where you are. Airplanes, we've got a solution for that. Offshore, we've got a solution for that. Your needs is our product. That's what we're selling. What's your need? Come and talk to me. Come and talk to me. I'm here. Medihealth solutions, medical and health problems. We solve that. Come and talk to us. We solve it. Easy. That's what we love to do. This is our passion. We solve it. This is what we sit together. You look like, these what's happening? There's a beehive, all the people putting all the brains in, all these experiences, about collective experience of about 87 years, putting it all into that. We're going to serve through this. We're going to take it to the next level. We all know where it's heading in 5 years, and we're ready for that. And if you're not ready, we're ready to partner with you. We're here like a sand poured in a pool of rocks. We're not here to displace or move you around or take your spot or compete. No, that's not us. We're here to fill the cracks and the gaps. We're here to make it one solid block of absolute care. That's what we're going to do. We will make it one solid block of the absolute care standards. Everyone's going to get there with us. Just think about it. Not just the at-home doc. These are the other services we provide. Some of you might have heard of it. Occupational health checks. I see these guys are in the middle of nowhere. They're offshore. If you're on the boat, in the middle, doing your fishing, or if you're in Laudaid, they're having your nice camping trip and you're stuck there. We always have a solution for that. I'm not going to disclose a lot about that. I'll leave you for the suspense scene, the brainstorming and thinking, what's these guys going to do? Yes, we're going to find a solution for that. No matter where you are, whatever you do, we're going to find a solution for that. And because this is not a creepy guy just looking, this is just the Benjamin Franklin guys, by the way. And he said, well done is better than well said, right? I talked a lot and I said we're really good, we're really amazing and all that. No, I'll let you observe what we have recorded for some of our patients later on tonight after I present my genius brother and actually the guy that actually made this thing happen with the assistant of his amazing wife that put up with all our. Can we give them an applause, please, man? Especially that lady there. She struggled a lot. We all really went through a lot. It wasn't an easy trip. We made it through. All these little kids there. They were like, not seeing us, not seeing the parents. My kids there. It is just because it's a passion. It's all for them. It's all for everyone. Everyone's kids. Everyone's kids are our kids. They're going to thank us one day. And I won't take more of your time, and I'll leave you now with my genius brother, Hatem, and he's going to take from there. Thank you very much for your attention.